So this is a new series that I'm about to start. So about drugs and drug knowledge and stuff like that. So I have my handy dandy my laptop ready for me so I can show you guys on how do beta blockers work. So this is a series, like I said, where this is drug knowledge and pharmacology in less than 10 minutes. So the first topic is beta blockers. So I want to explain how do beta blockers work, how do they affect us, and how do and where they are expressed throughout the body. Now, I just want to help people. Maybe you are an upcoming pharmacist or nurse or anybody in the medical field who wants to understand drugs and the pharmacology behind drugs. This is where you come to. This is pure drug knowledge and pure pharmacology from a drug expert. So, without further ado, let's begin. First, we have to determine where beta blockers are expressed and where they are throughout the body. So, we know that first of all, we have three types of beta receptors. We have beta 1 receptors, beta 2 receptors, and beta 3 receptors, of which I'm going to only focus on two, beta 1 receptors and beta 2 receptors, because these are your primary beta receptors that you will see in practice a lot. So your beta 1 receptors are your receptors that are located mainly in your heart and in your kidneys. As we look here, your beta 1 receptors are only located in your heart and in your kidneys. So you have your beta 1 receptors, like I said, located in your heart and in your kidneys. Your beta 2 receptors, conversely, are only located in your lungs and in your GI and in your smooth muscle. Now, I want to make this very clear. You have more beta receptors that are located in different parts of your body, but your main receptors are going to be your lungs, your kidneys, and in your heart and your smooth muscle. These are the four main ones you're going to see in practice. So let me say this again. There are more beta receptors that are located throughout your body. You're going to see mostly beta 1 receptors and beta 2 receptors. So what is a beta receptor and what do beta blockers do? Beta blockers block the effects of those beta receptors. So let me explain further. Beta receptors, or your beta agonist drugs that stimulate these beta receptors, they cause a direct increase of your sympathetic nervous system. Okay, you have to understand your systems, right? You have a central nervous system, then you have an autonomic nervous system. Okay, your central nervous system only consists of your brain and your spinal cord. Your autonomic nervous system consists of everything else in your periphery. So your autonomic nervous system is further divided into your parasympathetic nervous system and your sympathetic nervous system. Your beta agonists, beta 1s, beta 2s, and beta 3s, drugs that stimulate these beta receptors activate your sympathetic nervous system, okay? Your sympathetic nervous system is activated, which in turn increases your heart rate, increases everything else. So what do beta blockers do? Beta blockers counter this effect. It has an inverse effect. It prevents these beta receptors from being stimulated. So if we look at the mechanism of action of beta blockers, so what do beta blockers do? Your beta blockers, they block the action of epinephrine and norepinephrine. So what we know is adrenaline. Here in the US, we call adrenaline, right? But the generic name for adrenaline is epinephrine. So beta blockers block the effects of naturally occurring hormones that are already in our bodies from activating the sympathetic nervous system. When you are in a fight or flight state, your body is going to secrete epinephrine and norepinephrine to bind to these beta receptors to activate, to increase everything. This makes sense because you are in a fight or flight moment, which means you need to be on your P's and Q's so everything can be heightened. So beta blockers act by blocking this effect. So the mechanism of action of beta block, like I said, block the action of epinephrine and norepinephrine. It controls the heart rate, right? It produces a negative chronotropic effect on the heart. Beta blockers really control your heart rate, how fast your heart is beating, which in turn equals how much blood you are pumping out to your vital organs, how much perfusion your body is making to your other organs. So they block the stimulation of the sympathetic nervous system, like I alluded to earlier. And the effects of beta blockers, okay, they cause a decrease in your heart rate, a decrease in blood pressure, and a decrease in systemic vascular resistance. So if beta blockers control your heart rate, okay, they control your heart, they can slow down your heart, right? They don't want to produce super fast heartbeats, okay? That's what epinephrine does, or norepinephrine, things that stimulate these beta receptors. But since beta blockers block these receptors, they slow down your heart. They control the heart rate, right? Which in turn decreases your overall cardiac output, decreases your blood pressure, decreases your vascular resistance. And what is systemic vascular resistance, right? So if we think of it like systemic vascular resistance, it's simply that your preload and afterload. It's the afterload. The afterload is simply how much blood is being perfused and pumped out of your heart to the rest of your tissues via your arteries, okay? How much resistance is this blood facing once it is getting pumped out, okay? Think of it like, I don't know, just think of my hand, right? You have your artery this wide, right? This is normal. A good artery is wide, which means blood can be effectively and efficiently pumped out of your heart to the rest of your arteries with no resistance. Now, think of your arteries being super narrow, right? You have all this blood that's getting pumped out in large volumes at one time, like super fast. Look how much space it gets to maneuver and perfuse to the rest of your organs. Little, right? This is systemic vascular resistance, right? If this is very, very small, which means your heart rate is simply going to increase, your blood pressure is going to increase, and your stroke volume is going to go down, okay? Your stroke volume is how much blood is getting pumped out of your heart to the rest of your body via your arteries, okay? So if this is up, I mean your systemic vascular resistance is down, which means your blood pressure decreases and the demand on your heart decreases. So beta blockers decrease your heart rate, decrease your blood pressure, decrease your systemic vascular resistance, and creates a negative chronotropic effect, which is the rate of your heart, which is how fast your heart is beating, right? So we look at beta receptors. I drew a slight illustration on how it is. I hope you guys can follow along, right? So we look at beta receptors, right? This is just, this right here. This brown stuff, this is just to demonstrate, the receptors that's located in your heart, right? The blue dots are your beta receptors, right? Let me zoom in. Your blue dots here are your beta receptors. So when we get into a fight or flight response, right, or if these beta receptors are stimulated, norepinephrine and epinephrine will bind to these beta receptors, right? You can see they will bind to all these beta receptors and cause an increase and everything that I just mentioned, increase in heart rate, increase in blood pressure, increase in stroke volume. They would dilate the lungs. And your beta 2 receptors would dilate your lungs, and then your kidneys tell more renin to be produced, so blood pressure can increase, right? So let's look at what beta blockers do. And your beta blockers, they antagonize this, right? Your beta blockers are in red, right? Same picture, right? So your beta receptors are in blue, right? And then your hormones, which is your norepinephrine, your epinephrine, they want to bind to these beta receptors, but your beta blockers be like, nope, can't do it. They block these receptors from being stimulated, thereby controlling your heart rate, as I alluded to earlier, right? They control your heart rate, control a drop in blood pressure, control your systemic vascular resistance, increase your stroke volume, how much blood is getting pumped out. So you have two classes of beta blockers, right? I can mention them just for a second. So you have two classes of beta blockers, right? Beta blockers, things like metoprolol, labetalol, propranolol, atenolol. These drugs that end in lol are your beta blockers, right? They can be further divided into cardioselective and non-cardioselective beta blockers. So your cardioselective beta blockers, your cardioselective beta blockers, right? Your cardioselective beta blockers are your beta blockers that are highly selective for just your beta 1 in the heart only, right? They have a very high affinity for your beta 1 receptors in the heart and not on any other receptor. Yes, they still have effects on your beta 2s and your beta 3s, but at very, very, very small concentrations to where the effects is essentially non-existent. So these are cardio, which means your heart. So they are very selective for your heart. So these include bisoprolol, atenolol, these include esmolol, and metoprolol. So these are your cardioselective beta blockers. These are very specific for the heart. So all of these are very specific for heart. Very specific for your heart. For your heart. Okay. Now you have your non-cardioselective beta blockers, or just non-selective beta blockers in general, right? These include non-selective. These include your carvedilol, labetalol, carvedilol, propranolol is another one. Propranolol, and sotalol. So these are your non-selective beta blockers, right? Carvedilol and labetalol are very unique to where they have alpha blocking activity, right? Alpha blocking activity, they have activity for the alpha 1 receptors, right? And these are your only two beta blockers that have beta activity and alpha activity. So these also have alpha activity. And I'll go into detail about that in another separate video, but I just want to discuss all of your beta blockers and how they work to drop and control your heart rate, drop blood pressure, and the mechanism of action behind this, and the pharmacology. And I tried to be condensed in less than 10 minutes behind this stuff. I really trying to educate you guys in case somebody had really questions on how the mechanism of action of certain drugs work in the body, on how they affect heart rate, blood pressure, stroke volume, and cardiac output. So there you go, pharmacology, and I tried in less than 10 minutes. So give it a thumbs up. And the next video is going to be about blood pressure again, but just from different drugs. So we're going to talk about ACE inhibitors. Today we talked about hypertension, but treated with beta blockers. So hypertension can be treated with multiple different types of drugs. You have beta blockers, you have your calcium channel blockers, you have your ACE inhibitors, you have your ARBs. So the next video will be about ACE inhibitors. So I'll talk to you guys later.